Okay.
Okay, shall we start?
Yes, please.
Okay, start.
Hello, my name is Dr. Varda. Nice to see you again. How are you and how are you feeling?
Well, doctor, I'm just feeling the same, doctor.
Okay. So, so last time when you came to my clinic, uh, 3 weeks ago, you came to my clinic with a 1 month history of rectal bleeding, diarrhea, and 2 kg weight loss. Is that right?
Yes,
That's
doctor.
Yeah, and that's why I arrange a colonoscopy for you. And today you come here for your colonoscopy result. Is that right?
Yes, doctor.
Okay. So before I explaining you the result of your biopsy or colonoscopy, would that be okay if someone is waiting outside with you, so you can call in so I can explain your result?
Well, doctor, I'm just alone.
Are you okay? Can I explain the result? Hmm?
Yes,
Okay.
doctor.
Okay, so your colonoscopy result is in front of me. Unfortunately, it indicated that you are suffering from 2 centimeter tumor in your bowel wall, and I'm so sorry about that.
Oh, doctor, I'm shocked that I'm having a cancer, doctor. How will you manage this? I cannot believe that I have cancer.
Yeah, I can understand your feeling. If I were you, I will be the same. But you don't need to worry about. As far as there is a bad news, but there is a good news is that your tumor is confined to the bowel wall, and I'm going to recommend you for urgent refer to a surgeon. So,
Uh,
do you understand so far?
yes, doctor. So, doctor, you know what? 5 years ago, my aunt also died of this bowel cancer, and I saw her
Mhm.
suffering a lot during this chemotherapy. So, I just wanted to make clear that I do not need any kind of a chemotherapy.
Yeah, I completely understand your concern, but it depends on the surgeon and depends on the tumor size. If it is too large, they need to do chemotherapy in order to first what they're going to do. They remove your tumor, and then it depends on the size of the tumor. After that, they might do chemotherapy or radiotherapy, but it is not they can't do without your consent. They have to ask from you first. Is that clear?
Yes, and do I need colonos colostomy, doctor?
Yeah. Do you know what is colostomy?
Yes, a stoma and bag.
Yes, stoma outside your bowel. But as far as I can see your report. Your bowel, your tumor is within the descending, or your descending colon, which is mean that it is inside the bowel. It is not spread to other part of the body. So I don't think so. You need it colonoscopy. Okay. So, is that right? Do you have any more questions regarding that?
Yes, with the surgery cure my cancer.
Yeah, definitely. You have to be optimistic and positive about surgery because the success rate is very high. Okay, so and because your biopsy indicate that tumor is inside your bowel wall. It is not spread from one part of the body to another. Okay,
Uh,
so uh, okay, if is there any questions regarding that, so you can ask from me anytime. Hmm?
no, doctor.
Okay, so let me explain it to you what I explained it to you. Let me summarize you that your biopsy result indicate that you have suffering from 2 centimeter tumor in your bowel wall, but you don't need to worry about because there is a high success rate with the help of surgery, and the surgeon will going to remove your tumor, and you will be fine after that.
Mhm.
Uh,
Okay.
and there is less chance you need chemotherapy, but it depends on the surgeon's decision. Okay. So, do
Okay.
you understand so far?
Yes, doctor.
So, I'm going to do. I'm going to refer you to urgent referral to surgeon. So, hopefully, you will be fine. And if you need any help or any concern, please come to see me anytime. I'm here to help you as much as I can.
Thank you very much, doctor.
Thank you. Take care. Bye bye.
Thank
And
you.
here's your referral letter. Okay. Thank you, Mark.
Thank you. Okay, anyone else want to do this card?
Yes, yes, Dr. Hina, Assalamu alaikum. Yeah,
Wonderful.
I want to do it.
Okay, shall we start?
Okay, I'll be playing doctor part. Is
Yes.
it okay?
Yes. Start.
Okay, okay. Hi, my name is Dr. Pari. As last time we had meeting, and I think last time, if you remember, I told you that after 3 weeks I will give you the result of your biopsy. So here is the result in my hand. Are you prepared?
Yes, doctor. Can you please tell me what is it?
Yeah, okay. The result of your biopsy is um, you have uh, mm, you have a tumor of size of 2 centimeter, and it is confined in the descending part. Um, um, so. Um,
Well,
what
doctor,
do
I'm
you?
shocked. I'm
Mhm.
shocked, doctor, that I have cancer, doctor. You're saying I have cancer. I cannot believe that. Could you please tell me, doctor, how will you manage this, doctor?
Um, for that, I'm referring you to a surgeon, and it will be, yes, it will be removed surgically. If you have any question about it, you feel free to ask me, please.
Well, doctor, you know what? 5 years back, my aunt also had this, this kind of a tumor. She was having this bowel cancer, and she suffered a lot during chemotherapy. So I just wanted to make it clear that I do not want any kind of a chemotherapy or radiotherapy, doctor.
Yeah, actually, what the doctor will do is doctor will remove this tumor only, and but if the chemotherapy or radiotherapy is needed, then you can go through it. But it depends on you. It will be performed only on your consent. If you want, but surgery is a bit, it is very important. um, and after that, I hope you will be fine after that.
Okay, doctor. And doctor, what about this colostomy? Will I be needing this colostomy, doctor?
um, I appreciate your concern, and but the colostomy colostomy, I think you know about colostomy, or should I explain it to you?
I know about that colostomy. I'm just asking, will I need colostomy, doctor?
Hello.
Yeah, I know about colostomy. Could you please tell me, will I need a colostomy, doctor?
Uh, no, I don't think so. You need colostomy because the tumor is very small and it is only confined to one part of your gut. So you will not be needing it. You will just what you need is just a surgical removal of your tumor. Um, so you will not be needing that, I hope. But it
Okay,
just
doctor.
depends on the it depends on the doctor at that time when doctor will open it. But surely it will not be of that much colostomy.
Okay, doctor. And doctor, will this surgery cure my cancer?
I think you should be positive and you should be optimistic, and please think about it in a positive way, that it is going to be treated, and hopefully it will be it will be good for you. It will be very beneficial for you. so you don't need to be worried about it.
Okay, doctor. Thank you, doctor.
Okay, you're welcome. Please, I'm take my number and feel free to contact me. And here is your referral paper. And also, I will do it to the doctor directly. Thank you.
Thank you, doctor. Okay, yeah. Anyone else want to do, or should I just tell the mistakes now?
Uh, Dr. Hina, I'll try. I'll just give a try. This is like my first time, but I want to try.
Okay, what's your name?
It's me, Dr. Nafi here. It's
Okay,
Mohammed Nahyan
start.
is this is my account, yeah. Yes.
Yeah, yeah, okay,
So hello,
start.
Miss Hina. Hi, how are you?
I'm good, doctor.
Yes. So Miss Hina, so basically I just need to confirm you've come here for your colonoscopy results, isn't it?
Yes, doctor.
Okay, sure. So, Miss Hina, just before we start discussing all that, I just need to confirm few things. So, you presented 3 weeks ago, yes?
Yes, doctor.
Yes, with symptoms of 1 month of rectal bleeding, and you also reported some weight loss, yeah?
Yes.
Yes, perfect. So, just before see, today's it's going to be discussion about what has come in your results and what is it all about. So, before I start my discussion, I want to know something about you, Miss Hina. So, what are you expecting in your results? What are your expectations? What are you thinking? What's going on in your head right now?
Doctor, I'm just here for my results. Could you please tell me my result, doctor?
Okay, sure. So you want straight. Is there anyone else with you, or you're just alone? You're fine listening.
Well, I'm alone at the moment.
Okay, sure. So see, dear, we have done, so just understand this carefully. We have done this colonoscopy and we have figured out that there is a tumor in your bowel. There is a tumor that we have found.
Oh, well, doctor, I'm shocked that you're saying that I have cancer. It means that. So how will you manage this, doctor?
See, dear, okay, so let's begin with it's a very small tumor. It's like, we stage our tumors in sizes. So this tumor that we have found in a bowel is around 2 centimeters. So it's kind of a small tumor. So the best management of such kind of tumor is surgery. So for your case, I'll be referring you to the surgeon. So it will be an urgent referral, of course, and the surgeon is going to examine you and is going to test you, and accordingly he's going to take it far. But surgical management is the best management for your case.
Okay, doctor, that's good, doctor. And could you please tell me, doctor, about this chemotherapy and radiotherapy? Because, 5 years ago, my aunt just died of this bowel cancer, and she suffered a
Mhm.
lot during this chemotherapy and radiotherapy
Mhm.
sessions. So I just wanted to
Mhm.
make sure that I do not receive this.
Okay. See, Miss Hina, the thing is that it's always the patient's right to give the consent for what he or she wants. Now, see, after surgery, so this is the decision of the surgeon, and there will be a discussion between you and the surgeon later. Usually, after the surgery, you might or may not require a chemotherapy, but again, it's your choice. So if you're not comfortable with chemotherapy, we will not go forward with chemotherapy. So it's up to you. It's your choice.
Okay, doctor. And what about this colostomy? Will I need that?
Okay, so you're aware of what colostomy is, isn't it, Miss Hina?
Yes, doctor.
Yeah, okay, perfect. See, the thing is that, as I mentioned earlier, that your tumor is just 2 centimeter, and the thing about your tumor is it just is that one place. It's not spreading. As far as the colonoscopy result, it's not spreading. So the thing is, as far as my expectations, you do not require a colostomy because it's a small tumor, just confined at one place. So you do not require one.
Okay, and will this surgery cure my cancer?
Of course, that is basically the management for this treatment, management for this condition. So we are expecting, and the success rate of surgery for such cases is quite high. So definitely, you have to be quite positive about this fact that yes, surgery is going to cure your cancer. So let's be optimistic with this, and plus, we have taken a biopsy during your colonoscopy, and all that it says is that particular cancer is just confined to that place. So yes, let's be optimistic, let's be positive, and yes, definitely surgery will cure your cancer.
Okay, thank you.
Okay. Yes, Miss Hina. So see, I'll just make the required papers and documentation. So right now I'll be referring you to the surgeon, and you can always get back to me if there's any question, if there's anything that you want to ask. I'm your doctor, you can always ask me. And for the time being, I'll make the papers and I'll send you as an urgent referral to the surgeon. So is that all right, Miss Hina?
Yes, doctor.
Okay, thank you, have a nice day, Miss Hina.
Okay, thank you. Okay, we will start with Varda. Uh, Varda, there was no name, no address. You didn't, make a proper introduction. It's very better, in OET speaking, you have to be formal. You can't be casual. Okay, hi, hello, how you doing? How's this? How you're feeling? This, that. No, you can do that, but you have to do it in a very casual way. So having a proper introduction and having a good conclusion is very vital. Okay, so in your case, further, there were many grammatical mistakes. A lot of grammatical mistakes was there, like you didn't ask for the name, you didn't address me with my name, and you didn't give your introduction. Apart from that also, okay, you come here with for the reports, it will be came here, okay, and explaining you, no, it's not explaining you, it will be okay before I explain, or okay, before I explain or discuss the results with you. Again, someone is outside. You can't be that informal. Okay, is there someone sitting outside? You have to put your sentences in a proper way. You have to construct your sentences in a proper way. Okay. Okay. Colonoscopy results in front of me. No, that's very informal. That's not formal. That's very casual. Just it's like a beginner English. Okay. Okay, it's front of me. No, no, you have to be very formal. Okay, first I will tell you mistakes. Then feeling will the same. No. Again, you just use this. Okay, you are feeling will feel the same. Okay, fine. If I would have this cancer, my feeling will be the same. No, this you don't have to do it. You have to. This is the example of a breaking bad news card. So you have to be very empathic. And at some point, all three of you, just understood this card. Um, Okay, you misunderstood this card. Oh, I will just explain it better. And bad news, and there is one bad news, and there is one good news. Again, it's informal. Depends on the surgeon and the tumor. No, it doesn't depends on the surgeon or the tumor. It's written in the card clearly that, okay, fine, she's having this size of the tumor, she's having this, she's having this, and this will be done, this will be done. It doesn't depend upon the surgeon. It's not like that, okay, fine, the surgeon just, depend whether the surgeon will do the chemotherapy or no. No, it's in the card. Okay, the surgeon will discuss it with you further, or before the if required, if chemotherapy or radiotherapy is required, the surgeon will discuss it with you. It doesn't depend upon the surgeon or the surgery or the tumor. No. Okay. And again, all three of you did the common mistake, was that, what is colostomy? Like, I'm just asking you, if I'm using a medical term and I'm just asking you, okay, fine, will I need a colostomy? So it means that I'm aware of that. That is why I'm asking you. But instead of answering me, you are just questioning me back. Is that okay? Do you know what is colostomy? I hope you understand what is colostomy. That doesn't seems good. Okay, and you in one sentence you just said, okay, you need, no, you will need, it will, and again indicates less chance to get chemotherapy. In this card, nowhere it is written that there is a less chance that the patient will get the chemotherapy. In this card, nowhere it's written. So it's very important that never go against the card. Okay, if it's written in the card, okay, just go with that, but never go against the card. If it's not written in the card, yes, you can explain it using your terms. You can just use your everything as else. You can use different terms, technology, terminologies, everything. But against the card means that, okay, fine, if it's written that, okay, patient will not need chemotherapy, then you will never say, okay, fine, maybe if it will, if the tumor has spread, then you might need chemotherapy. No. If it's written, okay, then if there is nothing, if there is nothing written about the chemotherapy in the card, okay, then you will not say, okay, fine, your case is very this, that is why you will not need this, because in the card it's clearly indicated that it will be done with the patient's consent. Okay, so this was the point that you have to take into consideration, nothing else. And yes, now coming to Pari, you need lots of practice. Your English is not that good, and you're having very you know you were having a lot of grammatical mistakes. Apart from that grammatical mistakes, you were just, stammering like, which you have to stop that. Okay. Again, your introduction was informal. Hi. Never started with hi. Hello, good morning, or good evening, or good afternoon. Okay, we have meeting. We had a meeting, and it's not a meeting. We had an appointment. Yeah, you visited me. You visited me, and yes, one more thing which you just misinterpreted was that you said, okay, I will give you the results in 3 weeks. Okay, 3 weeks I will give results. No, you were not supposed to give the results in 3 weeks. In my last visit last month, when I presented with a 3 weeks history of uh, yeah, I present you presented 3 weeks. Yeah, I presented 3 weeks ago with a month history. So it was not that, okay, you were you were on duty, or you were just uh, obliged to give me the results, or 3 weeks later. Again, results in my hand. Again, something very informal and doesn't seem good. Okay, for that I will refer to surgery. No, I will refer you to a surgeon. Yeah, the surgery department. It will be must be more better. Okay, doctor will open it. Like, you are giving an English exam, the doctor will not open it. Doctor will perform a surgery. A doctor will operate the tumor. He will not open it. That's a very lame and layman English. Already colostomy. Again, you did the same thing. Okay, you were just asking me, you already know colostomy. I'm thinking that you already know about colostomy, so it's better to avoid this kind of question. If I'm just asking you, if you are just confused because in the bracket, uh wait, yes, in your card there was nothing written in the bracket. Okay, in my card it was written, okay, stoma and back, so you can just explain it. Okay, fine, colostomy. Well, basically colostomy is just a stoma and back, and in your case, as your tumor is just confined to the descending colon, so that the good news is that you will not require colostomy. Okay, and take my number, referral paper. That's again very informal and a very bad conclusion. Okay, now moving to Dr. Nafi, your English is good. There were very less grammatical mistakes, or I will say that there were very minute grammatical mistakes that you can just, it might be get ignored. But your introduction can be more formal. Your introduction was casual, like, hi, this is like this. No, just avoid it. Just give a proper introduction. Hello, good afternoon, Miss Hina. And yes, this is your follow-up patient. So you would have asked the examiner in the preparation time that, okay, fine, could you please tell me how may I address you, because you are my follow-up patient, or whatever, or I just want to, start the card with your name or something like that. You just discuss it with the examiner before you start the card. Okay, and then you will say, okay, fine, hello, Miss Henna. Nice to see you again. Yes, and in instant, yeah, Miss Nafi, Dr. Nafi, when you were just doing this card, you seem to be very happy, you were in a very good mood. So, the tone also matter in OET. You have to change your tone, according to the situation. If you're giving a patient a good news, then yes, your tone should be very excited, high pitched and something. But when you're giving a patient a bad news, then, tone should be, but you were, very excited, very happy while you just open this card. And again, what's going on your head, this that is something like that. Again, this will work better in PLAB 2, not in OET. Okay, because you just have 5 minutes and you have to just do it, this card. And moreover, in OET, it's very important that you have to be very empathic to the patient. Okay, and you have to be very empathic, and you have to show some kind of a sympathy to the patient. So it's necessary to avoid these kind of sentences. Okay, these sentences will help you in PLAB 2. Definitely, it will help you in PLAB 2. You ask the patient, okay, fine, because I don't know from which center you're going to appear, but in Saudi Arabia and in Pakistan, many students, what's going on in your head. Could you please summarize it for me? This, that, something. The examiner just say you simply, "Mujhe nahi pata." Just to follow the card, or I don't know, just follow the card. I will just read the question. So, and but if you're just going to give, when I just gave it, in Qatar and somewhere, so the examiner was literally an American, and he was just conversing me whatever the question I was asking, and he was just replying me back apart from the card. Okay, again, your layout should be proper. And again, my expectation, no, it's not your expectations. Okay, my expectations are that you will not get chemotherapy. Why you're expecting that? In the card it's clearly written that you will, the patient, if required, it will be done with the consent of the patient, and the surgeon will discuss it. It's not you that you're expecting, but you can say, okay, most likely, it will not be required, but if needed, the surgeon will discuss with you. Okay. And when I said, okay, fine, will the surgery cure my cancer or something like that? Of course. No, you don't have to open the sentence with just, of course. No, you have to be empathic. Just, just this saying, of course, okay, fine, tickets are good news. No, you will just have to be, and then again, you will just taking, expecting, and when in the end also, you would just like, okay, fine, I'm taking taking this biopsy, and then it will be done, this, that. No, you're not taking the biopsy. You're just telling that the biopsy results indicates that you are not going to take the biopsy in the end. Okay, so I will just give an a quick overview of this card is that this is a breaking bad news card. You have to be very empathic and sympathetic to the patient. It's not like that, all three of you, there was not that much sympathy in the card. Okay, fine. How you will start this card is, okay, fine. Hello, good morning, Mr. Peter. Nice to see you again. As you already know, I'm Dr. Henna, one of the treating physician in the suburban clinic. So Mr. Peter, so you are here for your biopsy or colonoscopy results. Am I right? Pe main kahungi, yes, doctor, whatever is. And yeah, one of you, I think so, it was Verda. It was like she was saying, unintentionally, तो वो तो avoid करना है. ठीक है. Yes, so yeah, you get biopsy results are with me. And yes, if you want to say that, okay, fine, is there someone accompanying you? ठीक है. Is there someone accompanying you, and or if you want someone to be next to you when I, reveal the results, because the reports are not that good, or the reports are not what we were expecting. That these are some kind of a formal sentences you can use it. Okay, okay. Then I will say, okay, no, I'm alone. Okay, okay, Mr. Peter. So the news is that, okay, fine. This is indicates that you are having uh, what you're having a descending colon tumor, and the biopsy has confirmed that it's a cancer, and the tumor is of 2 centimeters in size and it's confined to the bowel wall. How does this sound to you, or how do you feel? I would say I was shocked, this, that. Okay, fine, take it. How will you manage that? I understand, Mr. Peter, this news has come to you as a shock, and it's very natural for a person to behave in that way. Regarding the management of this tumor, I will just make an urgent referral to a surgeon, so the surgeon can make a further follow-up, or you can, the surgeon can discuss what will be done next. Okay. How does this sound to you? Something like that you would just say, and then the patient will ask, okay, fine, will I need a colostomy? Well, Mr. Peter, I understand that you're very much worried about your condition, and you just wanted to know about the colostomy, but the good news is that your tumor is confined to the descending colon, in which colostomy is usually not required. Colostomy is just required for the ascending colon tumors. Just you have to extend it because you have to talk for the 5 minutes. Okay. Then again, will this cancer? Yes, Mr. Peter. I appreciate your concern. Yeah, I can see that you're quite worried about your tumor, but the good news is the your cancer can be treated with the surgery, and the research shows that the prognosis rate is 100% once the tumor that which is confined to the bowel wall or in the descending colon is surgically resected, it does not grow back, and the prognosis is very good. This, that, इस तरह करके you will just do you have any further concerns, because I'm still worried about my condition, or you can just ask, okay, fine, is there anything that is bothering you? Then I will just discuss it further. Okay, fine, no, it's, if it is or if it is not. Okay, it was pleasure meeting you, Mr. Peter. Here is a leaflet which contains all the information about the what descending colon sorry, yeah, tumor confined to the descending colon, and you can just, and about chemotherapy and colostomy. So you can just take this home and read it at home. And if you have any further concerns, you can contact me. And Varda just summarized it. When you're just summarizing it, then you also summarize it in a proper way. Okay, fine, Mr. Peter. Let me quickly give you a recap what we have discussed so far. So what your results confirm that you're having a tumor in your lower bowel or this descending colon, and to treat this condition, I would just make an urgent referral to a surgeon, and you were concerned about colostomy. So in your case, the colostomy will not be required because the tumor is in the descending colon. And about the prognosis or the success rate of the surgery, or how this tumor will reappear, or whatever you want to say, just you can say at that time, it's negligible. And research shows that, this once treated with surgery, it do not reappear or reoccur somewhere else. So do not worry about that. If you have any further concerns, here is a leaflet and here's my contact number. Or you just can say, okay, fine, if you have any further concerns, I will say, okay, Mr. Peter, it was nice meeting you. I will just make an urgent referral, and here is a leaflet. You can just read it. If you have any further concerns, you can contact me. I wish you a speedy recovery. Have a nice day. Thank you. Bye. This is a proper way to make a conclusion. If any one of you have any questions, please ask, because this meeting will end in 3 minutes. मेरी आवाज आ रही है? Hello.
Hello, Dr. Henna. I have one question, please.
Yes.
Yeah, if there is no name in the Q card, then we can we pronounce any name?
No, you will
to
ask
the
the examiner. You will ask the examiner. किसी भी Q card में,
Okay.
in any Q card, there will be no name. You will have to ask the examiner. Okay, fine.
Okay.
That's the introduction. Okay, you will ask, okay, may I know your name and your name or age, or you can, could you please, how may I address you? Okay, and then you will ask, okay, what's brought you here today? But this is the follow-up card.
Yes, ma'am, just another question, that this is the second time the patient is coming to you. So you know the patient. So is there any need to introduce yourself or to ask
It's better
the
because
person?
again, it's better to introduce yourself. Because see, the way I introduced myself was not, making it a separate chunk. I was just saying, okay, as you already know, Mr. Peter, I'm Dr. Dr. Henna, one of the treating physician in this suburban clinic. And so you visited me, this. You would just discuss that. I just discuss. If you don't want, you can just skip this also. But it's better. Again, you will be having 5 minutes to talk. And you have to, just you have to keep talking in that 5 minutes. And usually it is noticed when you are having the mocks, or when you are in your in exam, you usually talk very fast. Okay, so the 5 minutes just vanishes in the glimpse of eye. So it's just important that you, okay, fine, give the introduction, just go in a proper way. Introduction, then okay, fine, ask for the complaint, ask any relevant questions, if examination or something like that. Then in the end, you will just give the conclusion and end the card.
Yeah, and I'm sorry, I became confused because my my mic was not working properly, and it was not fixed in my ear, so it was just falling down, and I was busy in again putting it back. And so I think it is the first time I'm doing this, so maybe next time I'll be more I'll be better. And thank you so
Inshallah,
much.
inshallah.
Yeah, I understood a lot of things.
Okay, so I will share the recording with you all, and I will end this meeting. Then we will do another session soon. Okay.
Thank you so much. Thank you.
Thank you.